Welcome everyone to tonight's webinar on communication and swallowing disorders in dementia. We're very pleased to have Allison Chen with us tonight to give the presentation. And Allison is a speech and language pathologist, and she works at the H.A. Leeper Speech and Hearing Clinic at Western University. Allison's going to give her presentation, and then at the end we will take questions from everyone. So if you want to enter your questions into the Q&A, which is located at the bottom of your screen, it says Q&A and there's a little question mark, and you can click on there and type your questions, and we will read them out to Allison at the end of her presentation. All right, so welcome Allison, and I'll turn it over to you.
Perfect. Thank you, Tara. I'm going to share my PowerPoint with you all. All right, looks like it's up. Perfect. So thank you, Tara and Sonia and McCormick, really, for letting me come to speak tonight and talk to you all about an area that I really enjoy providing services for. My name's Allison. I'm a speech pathologist at the Leeper Clinic at Western, and I will be introducing communication and swallowing disorders in dementia. So I mentioned I'm an SLP, so speech language pathologist for short. You'll hear me use that acronym throughout this presentation. But I'm also a clinical educator, so I mostly work with adults with neurological diseases, and I supervise and support speech pathology student clinicians in their journey while they're at school at Western. I spent several years prior to that in London, where I worked in hospital systems and in research in providing care to persons living with dementia and their caregivers, and also providing education and training programs to care staff. My interest in dementia started before I even became a clinician. It came from a personal place based on my grandmother's diagnoses of dementia and the years and years that my family had spent caregiving. So I'm honored to be here with you today and talk about some topics that are near and dear to my heart. So tonight, my goal is for you to walk away with more knowledge of what is communication, what is swallowing, and how they can be affected in dementia. It's important to note that every individual's journey is different, as I'm sure you know. So I am speaking to a more general lens today. However, if you have those specific questions, please don't hesitate to put them in that Q&A, and I'll try my best to answer them at the end of today. Another goal for today is to show you how you can support someone with a communication or a swallowing disorder. So I'll be walking through what to look out for to identify a possible disorder, as well as some general strategies that you can use to manage it at home. And then finally, I want to talk about the role of SLPs, or speech language pathologists, in managing these disorders in dementia. I've also got a couple resources available to you. I have a wonderful handout that my students put together, and I've shared that with Tara and Sonia, and they'll distribute that to you all after some point after our webinar. So we're going to start off talking about communication first, and then I will jump into swallowing afterwards. So with regards to communication, all of us in many ways are masters of our communication. So from the moment we're born, we begin to learn how to communicate our needs and interact with the world. We learn not only the language that we speak, but we also learn the social norms to communicate in our culture. And as we get older, we continue to build and refine on this communication. And first and foremost, I want to ground us in the idea that communication is about sharing a message. However, it's more than that too. It's an essential human right. It's essential for advocating for our needs and our wants, for connecting with other people around us, and for just generally interacting with the world. When you think about your life and how many times you have to communicate to share a message, you'll notice that there are very few times in which we're not communicating at all. So when you think about sharing that message, Oftentimes, the first thing that people think of is talking or the words themselves. However, communication is about reaching a shared understanding. And as a result, there are so many ways beyond words that we communicate. So this includes things like writing, drawing, painting, gestures, facial expressions, body language, intonation, stressing certain words, how quickly we're talking or how slowly we are, sound effects, and more. Our brains are really ingrained to pay attention to all these little details and put together a big picture about what's going on. It tells us how someone's feeling. It might tell us someone's age, their gender, where in the world they're from. And all of this helps us adjust our own communication as well. So, why does communication matter? According to data from the Canadian Institute of Health Information, we learned that in 2022, they collected all these statistics and showed that up to 75% of residents in long-term care have communication disorders as a result of dementia, stroke, and other conditions in Canada. So this is a huge number, probably varying from different organizations, but it tells us that communication disorders, that there's a high number of them in people who have different neurological conditions. And we also know that communication disorders can impact safety. It becomes hard for that person you're caring for to communicate their needs and their wants, and that means they can have difficulty advocating for what they need too. They also have less autonomy in important decisions. So being able to make decisions about finances, where they live, legal decisions, health decisions, there's really many, many major decisions out there. We also know it can result in more safety incidents. So for example, if someone has a communication disorder and they're also at high risk of falling, they might have trouble understanding and then remembering what was communicated to them. They may have trouble recognizing that there's a gap in their knowledge, and they may have trouble being able to effectively ask any questions they have. Communication disorders can also impact quality of life. So there are several studies out there that have shown that it increases social isolation. Relationships are often based on communication, and when that changes, connection can be really hard to maintain. People with communication disorders are involved less in their hobbies, in leisure activities, and in their occupations. We also have seen that people with communication disorders, particularly in dementia, have increased responsive behaviors. So this means that they may have trouble communicating their needs, which leads to their needs being unmet, and this can lead to more behaviors. They're also at a higher risk of mood disorders like anxiety and depression. And of course, it can also cause more caregiver burden because you, as the caregiver, have to take on more than just the physical aspect of caregiving. So next, I want to talk a little bit about how communication actually works. And this will segue into those different communication disorders that I'm going to go over. So communication starts in your brain. This is your control center. Perhaps you're responding to a question or you're making a statement. Your brain makes a plan. It pulls together the words that you need, the grammar, sentence order, word order, what are the right sounds, what are the right muscles that you need to move to make those sounds. So communication is a pretty complex plan that your brain has to create. But once your brain has that plan, the next thing it wants to do is tell your muscles how to move in a very precise way. These muscles are the ones in your chest, managing your breathing, in your throat, in your vocal folds, in your nose, your mouth, your throat. These muscles need to be strong enough, they need to be quick enough, and they also need to be coordinated enough to do exactly what the brain needs them to do. Not too little, not too much. Your lungs push air out through your voice box, where your vocal folds will vibrate to make your voice. And then your throat, your tongue, your soft palate, your lips, they all shape themselves. And this helps to create the sound of those words that you want to make, as well as direct the air flow out. And finally, your message comes out, but it's not done there. Your brain starts to do some quality control with your ears listening and your brain processing for what you said to double check that it came out the way it was supposed to. If something wasn't quite right and your brain kind of noticed that, oh, that sound wasn't quite right, it might try again and adjust that message. So I describe all of this information because for many of us, communication is just something we do. And we've been doing it for years, and many people don't realize how precise and detailed that it can be. So this is why that any changes to the brain or to these muscles, um, those changes that can happen in dementia, can result in a communication disorder and can cause a noticeable difference. So next, I'm going to break down some three big components of communication. There is language, which is the content of what we say. It's what we understand, read, and write. There's speech and our voice. These are the sounds made by our muscles and vocal folds. Without these sounds, we don't have a way to share our language or our words. And then there's cognition. So these are our thinking skills. It influences our ability to hold appropriate conversations, pay attention to what we're listening to, and remember what we discussed before, and then organize and plan what we're going to say. So I'm going to dive into each of these components and what happens when there is a disorder. We'll start with this first one, language disorders. So this is about that content, the talking, the understanding, reading, and writing. There's a lot of terminology out there that describes different parts of or types of language disorders, but some common terms you might hear or have heard already are things like aphasia, anomia, language impairment. Language difficulties can appear early on, and maybe they're hard to catch initially, but as there are broader changes to someone's cognition and behavior, those language changes can become more apparent. Uh, they're also most commonly seen in primary progressive aphasia, Alzheimer's disease, Parkinson's disease, Lewy body disease, and more. And I want to note that anytime I'm listing things, that this is not a final list because, like I said earlier, everyone is different in how they present. But I am listing some of the common ones that we see them in. So here's some things of what to look for if you suspect that the person you're caring for has a language disorder. So one of the first ones that is the most common one I hear is they have trouble finding the right word. So this person is pausing a lot. Words that they knew well before are really hard for them to pull out and say, and it's impacting them in their everyday and quite frustrating. Perhaps they're using vague or non-specific terms. For example, maybe instead of specifically saying a word like mug, they'll call it the thing. Maybe they're describing something that happened last week. They may say, we went to the place. Another example of something that can happen is they may have trouble recognizing things they used to recognize. This can apply to objects, furniture, equipment. For example, they might have difficulty recognizing a pencil and then have trouble knowing how to use it. Some people have trouble understanding what you're saying. You might find yourself repeating a lot, rephrasing a lot of what you're telling them. Maybe you notice they're having more trouble following along in conversations over dinner. It's important to also note that someone's hearing can play a big role in this. And it may not necessarily be that someone's having a communication disorder, but that their hearing looks like it's impacting their understanding. So we consider it a golden rule to always consider checking out your loved one's hearing first if you're wondering about communication. Some people may also have more trouble spelling while they're writing, and they may also have trouble reading and understanding what they would usually read. So that could be books, newspapers, things on the computer, text messages, anything that you can read. I find that people will gradually stop writing reading. They'll say it's because they don't enjoy it anymore. But part of this could be that it's becoming too difficult and it's becoming too tiring to do. So that could be a language disorder potentially. I'm going to move on into speech and voice disorders. So, this is when someone has trouble with how their brain plans for muscles to move and how those muscles actually move. So, some common medical terminology you may come across include words like dysarthria, apraxia of speech, dysphonia, and it can commonly be seen in Parkinson's disease, progressive supranuclear palsy, vascular dementia, Alzheimer's disease, and more. Some examples of what to look for include that overall it's just harder to understand them when they're talking, and it could be due to several things like their speech is sounding more slurred. Maybe those wrong sounds are coming out or not as precisely as they did before. Perhaps someone's voice is a lot quieter than it used to be. You're straining to hear them now, or perhaps you need to be in the same room or really close by to have a conversation. Perhaps they're running out of breath while they speak. They could be visibly short of breath during longer conversations. Maybe their voice is different, something about it sounds more hoarse, more strained, more breathy. Maybe it's difficult to tell what their emotions are from their speech. This is especially true if someone's was previously more expressive, but now perhaps more of a flat tone. And then maybe they have trouble with their speed, so they're speaking too quickly or too slowly, or it's changing. And then that last piece of communication, cognition, we'll talk about that kind of disorder. We call them cognitive communication disorders. That's just because as speech pathologists, we focus in on how does cognition impact communication. Cognition impacts many different things in your life, but we're focused on communication. So you may also hear it as a general term as cognitive impairment too, but overall, it's likely that if someone has dementia and cognitive changes due to the nature of the disease and the impact of cognition, that they are likely to experience a cognitive communication disorder. Some things that you can look out for or notice include trouble concentrating while talking or while you're talking to them, which might make them miss important information. They might have trouble talking while doing other activities, especially if they were a big multitasker before. But now they really have to focus on one task at a time, or they can't talk at the same time that they're doing something. A common one is remembering important dates and people's names in conversation. Sometimes they can miss jokes or sarcasm in a conversation, or maybe they have trouble themselves using humor too. They might feel overloaded when there's a fast-moving conversation, especially if there's multiple people or a really busy, noisy environment. Perhaps they're overly talkative now, more than they used to be. And on the opposite end, perhaps they have trouble realizing when it's their time to speak. Maybe there's a moment in the conversation when it's clearly their turn, but they have not jumped in and don't realize perhaps that it's their turn. And they may also have trouble sharing information in an organized way. So it might be hard for you to follow. It might have many different topics, often going off topic. And I want to stress that with all of these examples that I'm giving you, that these are about characteristics that are new with the diagnoses. So when I list out these examples, it's about a change that's happened in the person. So, for example, if someone's always been a quiet person, then if they're still a quiet person now, that doesn't necessarily mean that they have a communication disorder. So next, I want to talk about some general strategies for communication. Uh, Not all of them will necessarily fit the person that you're caring for, but these are a place to start and try out if you're not already. First, consider your environment. This is always that first step. Is there anything you can do to minimize distractions, like moving to a quieter room, turning down any unnecessary noise, or cleaning up the area where you're sitting so it's not as cluttered? You can also sit face to face, which is one of the easier strategies to use because you're both close to one another. You can both see one another's faces, see each other's lips, and get context from that. Second, your role as a caregiver is always uh, evolving and going to evolve, and that can be very difficult to have that always changing role with the progression of dementia. So, with all of these strategies, they're going to ebb and flow, but one of the big things you can do to help that person maintain their personhood is to focus on connection and conversation. So to do this, you can speak to them with an adult tone of voice and vocabulary. And this doesn't mean you can't adjust your communication. You can still shorten what you say if that helps. You can substitute a word. You don't have to use the really long word. You can use a shorter one. The goal is to avoid speaking to them like a child, which can be challenging for them, even if they're not expressing it. Another strategy is to reduce testing questions. So, examples of that include asking, do you remember what happened last week? If you already know what that answer is. Another example is withholding words from them, even though you understood them. So they're trying to say something and you're just letting them work it out. That may not necessarily be helpful in effective communication between you two. Something I like to say is that this person that you're caring for has lots of people assessing them, testing them, but they also need people who are engaging with them to support them as a person. So that support can be just as important for their well-being. Next, I want to talk about a couple different types of questions when you're asking them for their needs and wants and opinions. So perhaps you start off with a question asking, what do you want to do this morning? And maybe that's a difficult question for them to answer. So you can consider some other question types. For example, a multiple choice question. You want to watch TV, see a friend, or something else. I always like to throw a something else option in there because oftentimes things are not always black and white. Another type of question is a yes/no question. For example, do you want to go outside? In which the answer could be yes or no. Do you want a coffee? Yes or no. I always say to use these ones with caution because if you're asking yes or no questions the entire time in a conversation, it can feel unnatural for you both, and it can also feel like you're interviewing them. While you're waiting for an answer, you may want to give them some extra time. Every individual is different for how much time that is. When I meet someone new, I like to start at least counting in my head for at least 5 seconds to slow me down. Sometimes I need more time than that, and sometimes it's less, and I learn this as I get to know them. Sometimes I get it wrong because it's not always going to be the same amount of time every single time. I wish there was a magical number, as much as we'd like that, but if I make a mistake, I just say, sorry, I jumped in too early or too late. Let's keep going. Another part of communication, something that I talked about before in some of the earlier slides, is that it's not just about talking. So for communication, you can get creative with it in sharing your message. Uh, for example, you can gesture or point while you're talking. For example, earlier today, I went to buy some lunch. Or, do you want to wash your hair tonight? Using pictures can also be helpful. It gives you a reference point with them. So, for example, pulling up a picture of a pet on your phone and then telling them a story about that pet. You could use sound effects. They're often accompanied with a gesture. For example, I saw the Olympic hockey game last night. Did you see that score? Right into the net. And then facial expressions. For example, I was pretty upset while driving today because someone cut me off. And then lastly, drawing and writing important words are an excellent way to have longer conversations, especially ones that might be lots or involve lots of different information. I have some examples on the side here. You can see these are supposed to be little pieces of paper. You can see I wrote Saturday at the top of the first one. I like to put the topic at the top, and then you can list some options for what's happening. So here I have a picture to signify and help with understanding grocery shopping. And then I also, part of my drawing, have a picture of a person in a chair for chair yoga. Same thing for dinner below in the piece of paper under there. These are some different options that you can write out for dinner. And this allows that person not to have to hold all that information in their head, but they can kind of see it written out and they can point and refer to things. You can see I added that magical option of something else, which allows them some autonomy to pick as is appropriate. And then here are some last general strategies to keep in mind. One of the first ones is to summarize what you understood. After a conversation has been a longer one or on a complicated topic, I always like to summarize. So, for example, I could say, what I understood was you want to go to Judy's on Saturday morning. Did I get that right? And then I use this because it gives us both a break because it can be tiring sometimes to guess. And you want to also make sure you're on the same page with one another. I like to also use this moment to think about what I'm going to ask next or some other strategy I might want to try next because I'm not a mind reader. No one is, but it's normal to need that time to think about it. And then finally, know when to step back. As you know, there are difficult days and there are easier days. Some days and some conversations are just going to be really tough to get through. So it's okay to say, okay, we've been at this for a while. This is hard. It's important though. Let's come back to it. And then I mentioned this a little bit earlier, but all of these strategies are always going to fluctuate in their helpfulness because at the end of the day, you are human, they are human, and you both fluctuate as well. Communication fluctuates. It's complex. Not every topic is the same level of complexity. So that means not all strategies are going to work for every person. Not all strategies are going to work every time. It's too complicated for it to be easy. But knowing these strategies and getting comfortable with just a few of them is a good place to start. And you can always add more and learn more as you go in the future. So now you've seen some different signs of a communication disorder and some general strategies. But how do you know if you need more professional support from a speech pathologist? Well, here are some guiding questions that you can ask yourself. I mentioned the first one already from before, You may want to ask yourself, is this different from who they were? Um, Having dementia can put someone at a higher risk for a communication disorder, so it's important to identify if this was a change. Next, is there a meaningful impact on their life? Impacting their participation in different things like maintaining relationships, carrying out hobbies, the list could go on. Uh, and are you frustrated and frequently misunderstanding each other due to this change in communication? Are other people frustrated and frequently misunderstanding them due to their communication disorder? And last, but also very, very important is this impacting their safety? Are they following safety instructions? So if you tell them to lock the front door, are they doing that? Are they turning off the stove? Can they attend appointments and leave with a reliable understanding of what their next steps are? What are they able to consent to so that they can be involved in their care planning and decision making? Are they communicating what they need in a timely way? Do they have trouble following your instructions or care staff instructions? So, some things to think about and ask yourself if you need more SLP services. Next, I want to jump into our swallowing disorders section. So, swallowing is the ability to comfortably and safely eat, drink, take medications, and also manage your saliva. You may hear it in the medical term as dysphagia. And I've added this picture, which I used for the communication slides, because we're going to zoom in on this section in the green circle that's focusing on the nose, mouth, and throat. Your brain is still really important in this, actually. It's still the control center of everything. And your lungs are still important as well. We'll talk about it more in the upcoming slides, though. So this is a set of pictures of the inside of your nose, your mouth, and your throat. You have the food in the highlighted yellow bit, and it's in different places across the different pictures. Your tongue is this big, thick muscle in the middle of your mouth. And down in your throat, you have two tubes beside one another. One is your trachea, which is your windpipe. It goes down to your lungs. And the other is your esophagus, which goes down to your stomach. You can see here that the trachea is wide open, while the esophagus itself is closed. And this is because we're generally breathing most of the time, so our airway remains open for that reason. As you can see in this picture, this person has food in their mouth. And when you put that food into your mouth, what happens is that you begin to chew it if it's something that needs chewing. You begin to move it around in your mouth with your tongue, your cheeks, and it collects with saliva during this time to help form a softer, more collected ball. After you've done this process, you begin to start the swallow. Your tongue moves the food to the back of your mouth, and during this time, your soft palate, which is connected to the little dangly bit in the back of your mouth, so your uvula, that soft palate lifts up and closes off your nose. This is important because it helps keep anything from being accidentally squeezed up into your nose. If you've experienced that before, it's very, very unpleasant. Then the food slides past your tongue towards your throat. It's not labeled here in every picture, but there is that like little blue part at the top of the trachea, at the top of the vocal folds. It's like a little flap, and this is called your epiglottis. This flap folds over the top of your airway like a lid on a container. And it actually closes your airway. It closes that tube that goes towards your lungs to help protect it while you're swallowing. Another protection your airway has is that you don't really see it in these pictures either, but your trachea, your larynx, this voice box, it actually moves forward and it moves up. And this forward and up motion pushes it away from the esophagus. So it lifts out of the way of the oncoming food. Then the muscles of your throat and your tongue, they squeeze and they contract to send the food further down. Your esophagus opens up, your airway, your voice box moves out of the way, and the lid closes down. And then the food can slide on safely down your esophagus into your stomach. When something is amiss in this process, it can make swallowing a lot harder. All of these muscles are working together to ensure that whatever is in your mouth is exactly where it needs to be and ensures that it goes where it needs to go. We'll talk about it in the next coming slides about what you'll notice, but you can imagine any changes to these muscles mean you might not be able to keep food in your mouth or adequately chew or move it around. Any changes further back in your mouth could mean it's harder to push the food down and make sure it doesn't accidentally go up your nose. Any changes even further down your throat mean maybe the lid doesn't close on your airway. Maybe your epiglottis doesn't close all the way. Maybe your airway doesn't move effectively out of the way. It doesn't do that forward up motion to move away from the food and the esophagus. And maybe your esophagus itself doesn't open in time or doesn't open enough. So this is a really intricate process that happens. Why does swallowing matter? We know that people living with dementia are at high risk of developing a swallowing disorder. Here are some numbers from various studies on it. You can see that there's a high number of people with dementia who also have Alzheimer's, Parkinson's, and also those who are in long-term care. Dysphagia can have a big impact on safety. People living with dementia can have a higher risk of what we call aspiration, which means anything that enters that airway into that voice box, the trachea, after you've swallowed. So again, this could be food, it could be drink, medications, and saliva. Typically, someone may cough or clear their throat to try and get rid of it. It's important to keep in that mind that people living with dementia are also at higher risk of what we call silent aspiration. So this is aspiration, where something goes down the wrong way, but there might be little or no sign that it's happening. You might not see a cough, there's no throat clear. They may even say that it went down okay. And this is because dementia can reduce someone's sensation in their airway, which means they just might not feel what's happening down there, and that might not trigger the cough or the throat clear that someone with some more typical sensation in here would do. Overall, aspiration and silent aspiration can lead to an aspiration pneumonia, which is a chest infection that develops due to this foreign material entering the lungs. And it can have serious consequences for someone's breathing and also be life-threatening as well. It's a pretty serious thing. Similar to aspiration, someone with a swallowing disorder can also obstruct, or that's another term for choke. And that stops them from being able to fully get air into their lungs as it's a blockage. It's the same idea that something's entering the airway that should not be entering it. Swallowing disorders can lead to people avoiding meals, foods, and drinks, and that can impact them in terms of malnutrition, dehydration. They may also lose weight because it is tiring and challenging to eat, and they may lose their appetite as well. It can also impact quality of life, unsurprisingly. People with swallowing disorders can develop a fear of eating, which is a perfectly natural reaction if they've experienced it to be unsafe and or uncomfortable. They may have a loss of joy in eating and drinking. They may not participate in events around meals, which in many cultures, food and drink are a big part of our gatherings. They may experience social isolation as a result of this, and changes to their self-esteem because it might be embarrassing to eat in public if you're coughing or uncomfortable or you have to eat slower than everyone else, or even just telling people that you may have a swallowing disorder. And then, similar to communication disorders, it can also increase things like anxiety, depression. Here are some important signs to look out for in the person you're caring for if you wonder if they have a swallowing disorder. One of the first ones is, are they having trouble keeping food and drinks in their mouth? Is it spilling out of their mouth? Are foods, drinks, pills getting stuck in their mouth? Maybe you look inside after a bite and they still have food in their cheeks or food at the top of their mouth, under their tongue. Pills can also get stuck in there as well. Another example could be that they're holding on to the things inside their mouth and not swallowing. So, did you watch them take a sip of a drink and they're holding it in their mouth? They haven't swallowed, but they may just continue on whatever other tasks they're doing, or maybe just keep holding on to it. Are they having any trouble swallowing their saliva? They might sound a bit gurgly while they're speaking. Perhaps they're always coughing or clearing their throat. That can be a sign, not always, though. Um, and then they may be having too much saliva, which causes them to drool more, and require a lot of swallowing to keep it from coming out. Opposite to that, maybe someone has a very dry mouth and they do not have enough saliva. So this can make eating and swallowing harder because it's important in playing a role to prepare that food to be soft enough to swallow and to help digest. Are they having trouble with chewing? Sometimes this can be due to people's teeth, and that's not necessarily a swallowing disorder, but just something like, for example, if they don't have dentures, dentures don't fit, maybe they prefer not to wear their dentures and prefer to eat softer things. That's okay too. Um, but you might want to look out for, are they chewing for a really long time? And because of that, maybe it's tiring to them. Maybe they're eating less of their meal. Maybe they're requesting for their food to be softer in general. Obviously, any coughing, choking, or gurgly sounds around meal times or taking just random sips of water or taking pills could indicate potentially an issue. Maybe they report that things are feeling like they're getting stuck in their throat after they swallow, or maybe there's some difficulties breathing during swallowing. Our breathing coordinates with our swallowing really well because our airway has to close off and move out of the way. So that process is really in sync. Oh, my bad. I clicked on. I exited out of it. I apologize. Let me get back to that slide. Okay, we are back. I'm going to move to the next slide here. So what can you do as a caregiver? Again, these are general strategies for swallowing that I always encourage. The most important one, you can see here that I put 4 stars next to it because of how important it is, which is providing thorough daily oral care. So brushing someone's teeth, taking care of their mouth. Over time, it will be harder for that person you're caring for to take care of their own oral hygiene. Ensuring that thorough daily oral care is done is one of the best ways to minimize the chance of aspiration pneumonia. So, by clearing out any potentially harmful bacteria in someone's mouth, there's less of a chance that it sweeps down with any food, drinks, pills, anything else. If that enters the airway, it will have a less of a chance to cause a pneumonia. You can always ensure that the person you're caring for is awake and alert before providing them a meal or putting anything in their mouth. If they're drowsy, they may have trouble controlling what goes in their mouth and swallowing it, and that increases their risk of aspirating or choking. Help position them to be as upright as is comfortable, or encourage them if you don't position them yourself. Gravity can be your friend, but it can also work against you. You can imagine if someone's leaning back, gravity's going this way, so it's harder to control what's in your mouth, especially if you have some difficulties already controlling what's in there, and things can accidentally fall back and go down the wrong way. Another strategy to use is to minimize distractions around the room. This is similar to communication strategies, and it's also helpful for swallowing. So anything you can do to keep that person focused on their meal or on swallowing as a task is recommended. I also always recommend that caregivers, if possible, learn first aid, especially in terms of choking, if the person they're caring for has a swallowing disorder, so you know what to do if they do choke on something. I always encourage people not to talk with anything in their mouth, especially if it's someone who might get distracted while eating and drinking, which can again impact the control of what's in their mouth. And lastly, if this is someone who will let you look in their mouth, you can always double check their mouth after medications, food, and drink to make sure nothing's left behind. This is especially important if that person you're caring for has difficulty staying awake, or if they do that holding onto food, pills, and drinks, and maybe they need that prompt to swallow. But it's good practice overall because sometimes you just never know whether they've swallowed it or not. So now, when do you need additional support from an SLP? Honestly, with a swallowing disorder, I always recommend that you see an SLP because of the risk that can be involved. So I suggest that you ask yourself these questions if you see any of the signs that we talked about. First and foremost, have they had a recent chest infection in the past few years? Even more so if they're having multiple chest infections. Obviously, chest infections can be due to multiple things, but if it's in combination with dementia or if it's in combination with any of the swallowing symptoms and signs that I listed, then that's more of a reason to look into that and make sure that aspiration and swallowing is not a part of it. Are they experiencing any unintentional and significant weight loss? Again, this can be due to many things if seen by itself, but it's something we want to monitor if they are also experiencing signs of difficulty swallowing too. And lastly, something to think about and or discuss with them includes what are their goals around swallowing? This is a deeply unique and personal perspective that every person has. Some people prioritize safety at all costs, so that's minimizing the risk of aspiration happening. Other people prioritize quality of life in that they want to eat and drink no matter what, knowing that there is a risk of things going down the wrong way and that the swallowing disorder will worsen with time. There's also a middle ground. It doesn't have to be an all or nothing approach either, and can be tailored to that person you're caring for, as well as you as the caregiver. This is can be a complicated and difficult discussion to navigate, and a speech pathologist can provide support with this. So, speaking of which, we'll go into our last section, which is about the role of SLPs or speech pathologists. We'll start off with communication disorders. So, SLPs are the experts in communication. We are attuned to track any changes in communication, and that can help if that information gets back to your healthcare team, that can help the rest of the team manage any diagnoses and care plans, and they can collaborate with them to support them whatever communication needs that you have. Speech pathologists can also provide individualized assessment and treatment to support communication safety and quality of life. So this is not only for the person you're caring for, but also for you. They can do things like determine whether that person you're caring for is eligible for therapy, as well as develop therapy plans to help maintain those skills. They can determine eligibility for um, and help develop visual aids, as well as augmentative and alternative communication, which is also known as AAC. So these are tools that support communication beyond talking and can help make communication more effective between you and that person. Speech pathologists can also not only develop these tools, but also help train you in these tools too. They can provide education and training for any care staff that are involved in this person's care. They can support any environmental modifications to wherever that person's living. And they can support advocacy for communication. So helping the person you're caring for participate in everyday activities and hobbies in important discussions as is possible. And SLPs also work closely with audiologists to identify needs for hearing. In terms of swallowing disorders, many of the ideas are the same in terms of what we do. We are the experts in swallowing. We are the ones who can determine the risk of aspiration pneumonia and assess for silent aspiration. So again, that's something that you can't necessarily see just by watching someone eat. In our profession, they are the ones who carry out our gold standard method, which is looking through a scope or imaging with a radiology department, and allows us to look inside the mouth and throat to confirm this. There are also other roles that we can help play, which is providing recommendations through environment, posture, maneuvers, strategies, and oral hygiene that work for you both. Depending on the disease and the research, some specific groups might benefit from exercises for short-term improvement. We can provide education and training just like we can for communication. Another thing we can support is diet modification. So oftentimes when people think of swallowing disorders, they think of diet modification, but it's really not just black and white. It's not just should this person eat pureed food or not? Should we be thickening their liquids? There are a lot of pros and cons to each of these changes. So a speech pathologist can help you make an informed choice about whether to do so and if that aligns with both of your wishes. And we can also collaborate with other members of the healthcare team to determine adaptive eating and drinking tools. Overall, any speech pathologist goal is to support communication and swallowing in collaboration with you as you have the expertise about the person you're caring for so that we can help with safety and help with quality of life. These are some online resources that I personally like to direct people to for both swallowing and communication. I can share these links with Tara and Sonia afterwards for them to distribute and move through my references. And then that's the end of my presentation. I thank you all for taking the time out of your busy lives. I hope this was informative. We have our Q&A period, but if there's any questions that are not answered today or you're wondering about speech services, you can reach out to us at the Leaper Clinic at this email and phone number, and we're happy to offer services or help direct you to the place where you can access what you need. Thank you very much.
Thank you, Allison. That was a very informative presentation. I learned a lot. It amazes me how much is involved when you look at the swallowing, right? Between
Yes.
breathing and swallowing and all of that. And it's amazing that we're able to eat it all.
I know it's crazy.
So, okay, so we'll take some questions now, and I see we've already got a few in the Q&A. So, first question up is, are there any apps that you would recommend to help facilitate daily communication?
Hmm. So I think that varies a lot depending on the person and their individual needs. There are some apps out there that are really broad and try to cover a lot of different things, but may not necessarily be helpful to you. I would suggest that having an assessment to really pick apart what is the specific need first before jumping into an app, especially if you want to pay for an app. That I would recommend an assessment first before figuring out what to do with technology.
That's great. Thank you. Our second question. So this person's spouse lives with primary progressive aphasia and frontal temporal lobe dementia. Partner's going to be going on a holiday, and so they're going to be left somewhere during that time. So the person with PPA and FTD doesn't have many words and
Hmm.
pretty dependent on their spouse. And so they're just asking, how should I communicate with this person that this is what's going to be happening? Are there some communication techniques that would be helpful?
Yeah. I would say as many visuals as you can, and really short words in an organized way. So maybe it's a one page with some pictures that of the new place that they're staying, and then that this is like home for them, and that you will be on maybe vacation, but will be coming back. So a really short and simplified way, making sure you have pictures as realistic as possible will help them. For example, making sure it's a picture of the home that they're in and a picture of you potentially too.
Great. All right, the next question is, if their person is speaking quieter than they did in the past, is it advisable to ask them to repeat themselves or ask them to speak louder? And are they actually able to do that?
That's a complicated question sometimes. Yes, I always suggest that if you need someone to repeat or try and speak louder, that you can go ahead and ask them. But whether they're able to do that or not depends on the disease itself. So, for example, in Parkinson's disease, if we're thinking about a quieter voice, they often get a quieter voice. Um, they may have trouble being able to do that. They're not as attuned to how much volume they're projecting when they're speaking. So, um, something speech pathologists can do can help attune them to paying attention to that volume level.
Great.
This person is wondering if someone's words aren't understandable, so the person lives with dementia and
Mhm.
we're not understanding what they're saying, is it likely that they actually know what they're trying to say?
That's a good question. It's always hard to say exactly in that moment. But I think they do know that they're trying to communicate something, whether it's not what it is specifically, and if they're attuned to the exact details of that, I couldn't really say. But if they're making sounds and they're trying to gesture or point, then they're trying to tell you something, and it's just hard to know what it is.
Okay, a couple more questions coming in here. So this person's spouse, I guess in the past, during their adolescence, couldn't speak for a few months due to a problem with their vocal cords, and they ended up having a few surgeries to deal with that. Could they have
Okay.
a relapse in which he thinks he's having issues again in his mind when he actually cannot talk, but in reality, there's not really any issue going on. So I guess are they kind of back in the past thinking that they can't talk anymore?
That's totally possible. Mental health and cognition can play a role in you being able to produce voice. So I can see how that might come to be, and that in the past he's experienced not being able to get his voice out, and it could be happening again. It's really complex. We don't really understand fully why it happens, but it can certainly happen that way.
So I guess in situations like that, is there something that SLP could do to assist with that?
Usually in those cases, there is a shared approach. So one, it depends on the severity of the disease progression. But then two, if they are an eligible candidate for therapy, oftentimes there is the speech therapist supporting, but also some kind of psychotherapist or counseling aspect of it to help work through what was happening there. So I can't say for sure for this person, but that would be the first step would be to check out if this person is eligible for therapy.
Okay, thanks. This person has a question in respect to excessive saliva. Um, their their mom is needing to constantly wrench her throat to spit it all out in a tissue or in the sink. So they're
Mhm.
wondering what can they do to help with this? And the person is 94.
Yeah, for sure. Um, I'm thinking of, and it might not necessarily be in your mom's case. I Some people, for example, with Parkinson's, have a lot of extra saliva and have to deal a lot with drooling. So one thing is to remind them to swallow, which can be really hard because we are actually constantly swallowing our saliva, and it happens pretty frequently. So having to be there to prompt them all the time can be challenging, especially if there's cognitive difficulties. Something that can help is we found that chewing gum in Parkinson's can stimulate people to swallow more and manage excess saliva. Now, again, I don't know if that's a recommendation in your case, as I don't know exactly what's going on with that person and with your mother swallowing, but I do know that that's something that can help people.
So I don't see any other questions right now, but if people have any more, feel free to enter them in. And I was just going to comment on we were chatting before the webinar tonight about where you work and if people are interested in seeing a speech language pathologist about getting referrals and having access to your services. So I don't know if you want to talk a little bit about that.
Yeah, for sure. I work at the H.A. Leaper Clinic at Western University. This is a teaching clinic, so we do have a lot of students around. There's always a possibility if you come to the clinic that a student may observe or be present in and involved. This is not always the case, but there is a high possibility of it. One thing to consider. We are fee for service, so we provide a reduced rate compared to the community for our services. And for people who demonstrate financial hardship, they can apply to our fee adjustment program, which can provide a significant discount on these fees. And the other thing that our clinic provides is we also are joint with audiologists. So if you don't need a speech pathologist, but you would like to check out your hearing, we have audiologists in the clinic who can also support that.
Right. And you were saying that it is self-referral, so people don't have to get a referral from a doctor. People can just contact the clinic directly
Hmm.
to book an appointment, which is wonderful. So
Yeah.
we can send out all of that. I'll get that contact information from you, and we can send that out to everybody after the webinar, so everyone has that. Yeah.
Okay. Yeah, that's perfect. Yeah, we have no barriers in terms of access. If you feel like you have a concern, then you can reach out.
Great. All right. I don't.
Someone's just wondering if you have a wait list.
I currently do. We say probably about a couple months at least to 6 months right now. It's not too bad at the moment. It may even be earlier, depending. There's an ebb and flow to it all. So I'll give you the conservative value, which is 6 months, but it could be shorter than that.
Another question that just came in, you mentioned in one slide intonation and stress. What is intonation?
hmm So you can think of that as like the melody in our voice. So as I'm talking, I'm kind of going like this as I'm talking, and then maybe if I ask a question, I kind of move in an upward pitch, and then maybe if I'm finishing what I'm talking about, I'm coming down in a downward pitch. Some people have trouble having that pitch change at all, which is a normal part of English speaking. So that change can impact people and be frustrating for some people. So that is what intonation is.
Right.
This person's just wondering what your best advice might be to be proactive if aspiration or choking were to happen. Um, and I think they're trying to say other than if it's for someone, I don't think this person's the primary caregiver, I think is what
Mm,
other than the caregiver. Yeah.
yeah, that's a good question. I would say that that piece I mentioned about first aid will always be helpful to you, making sure that they have first aid training and know what to do in the case of choking. Um, in that moment of aspiration, it's very challenging. They should know that they should monitor breathing is a big part of it, and any other distress that they're showing. If it's continuous and breathing is getting worse, then maybe that's they need to reach out to get further care from a doctor. As well as sharing, sorry, the strategies for positioning that I mentioned in our slides that can be helpful for people too.
Great. Okay, I don't see any more questions right now. So if people have questions afterwards, you think of them later, then yeah, just let us know or let Allison know and we can follow up at that point. We will be sending out a survey to everyone who's attended tonight, and along with that, there is a handout that Allison has provided. So we'll send the handout, and we will get the contact information for the clinic as well for people if they're interested in reaching out to you, Allison.
Okay,
All
perfect. Thank
right.
you very much.
Thank you very much. Great presentation, and thank you everyone for coming this evening. And hope you have a good rest of the night.
All
Take
right,
care, everybody.
take
Bye,
care.
guys.